Everyone. I am Karan Kalu, Director of Community Engagement here at NBCDI. Welcome to the National Black Child Development Institute's March Virtual Learning Series, creating healthier futures, prioritizing Black children's health and nutrition, pre-birth and beyond. I must say, I'm excited about today's conversation. In my role, I work closely with our National Village Network. Our villages are located in over 24 communities across the country. So today, to have the opportunity to highlight one of our villages is true delight. Today, our co-host is the president of BCDI-Colorado, Jalen Taylor, accompanied by Karan P. and Nadia Grace. We are also grateful to have one of our partners join us today, Mackenzie Bruner, Policy and Outreach Specialist from the Child and Adult Care Food Program. Special thanks to you, our panelists, for leading this discussion today. NBCDI's virtual learning series focuses on our 8 essential outcomes. The 8 essential outcomes are the embodiment of NBCDI's vision for every Black child and are the compass that guides our work. Today's webinar is focused on 2 of our outcomes, health and nutrition. NBCDI envisions a world where every Black baby is born between 5.5 to 8 pounds to lead a healthy life and reach developmental milestones. The Black woman's health imperative said, "It's not being Black and female that increases the risk of having a low birth weight baby. It's the connection between being Black and being discriminated against that increases the risk." Black women and birthing people in the US experience disproportionately high rates of negative maternal health and birth outcomes. And this includes babies born at low birth weight. As many as 1 in 7 Black babies, or 14.2%, are born at a low birth weight. This is 1.5 times the national average, which is 1 in 12 babies, or 8.3%. Being born at a low birth weight can have early and long-term health and developmental effects, including respiratory and heart problems, among others. NBCDI envisions a world where every Black child enjoys nutritious and inclusive meals with vegetables that honor each child's and family's culture. Children whose parents and caregivers introduce them to fruits and vegetables at an early age are more likely to enjoy meals with vegetables and can improve their diet quality later in life. Research shows that Black children are more likely to live in food deserts that lack convenient access to grocery stores that offer a variety of nutritious foods. More than 1 in 10 Black children, 12%, experienced food insecurity themselves, which can increase the risk of developmental delays and impairments. This data demonstrates why today's conversation is so meaningful and needed. I'll turn it over to Jalen Taylor to start the discussion. Thanks, everyone.
Greetings, everyone, and thank you, Karan, for that wonderful introduction to our virtual learning series today. So again, my name is Jalen Taylor, and I am the affiliate president of BCDI-Colorado, and I'm so grateful to be with you all today. So before we get started in the conversation, I just want to share a little bit about our organization. So we were originally affiliated as BCDI Denver in June of 2015, but as we started to see some of the trends that were happening within our ecosystem, we decided to expand and move into BCDI Colorado to be a statewide organization. We still operate and function under the umbrella of the national office, continuing their mission forward, but we've also added our own little jazz to our mission. And so we look to empower Black children and families and communities to thrive, flourish, and prosper by championing holistic well-being and fostering a bright future for all. And we enact this vision within BCDI Colorado by continuing to be a beacon of hope and prosperity for every Black child, family, and community. And so in this future that we're cultivating, we want to see a state where the Black child is prioritized regardless of their background, have equitable access to highest quality education, comprehensive healthcare, and a wealth of opportunities, providing them with the tools that they need to reach their full potential. And so we do this with a twofold approach within our work. And so we try to meet the direct needs of the community on the ground, while also doing a lot of policy and advocacy to create systemic change to render our services obsolete. Our number one goal is that if we're doing our job right, we will no longer be needed within the community, and we'll just continue to get to celebrate with you all. And so some of the programs that we implement annually is NBCDI's Good For Me program, which is their health and wellness program. We implement that in multiple sites, equipping teachers and children with food and resources, as well as providing family with gift cards and resources to access healthy food. We also continue to do the Read to Succeed initiative with our literacy boot camp every summer, which is 3 weeks worth of just immersive literacy and mentors and just lots of activities for children. And then we're moving into distributing our Sankofa boxes, which is a set of curriculum and resources and books that are given directly to schools so that they can have a wealth of literacy within their classrooms. But we also really look to focus on the policy and advocacy. And so we do that within 3 different coalitions. The first is being a member of the Colorado Department of Early Childhood Rules Advisory Council. We were instrumental in making sure that the Office of Early Childhood had its own department. And so we are in the process of creating all of the rules and the implementation for that, as well as universal pre-K. We are with Growing Our Futures, which is a subsidiary of Child Care Next grant with Alliance for Early Success. And then our longstanding partner for the last 5 years, Raise Colorado Coalition, which is a group of wonderful organizations that are continuing to push this work forward. And so in terms of maternal and infant mortality, when it comes to Colorado and the work that we're doing, so we pulled some statistics for our state specifically, and they're not as good as we want them to be, right? The preterm rate is still 10. Our birth term rate is still graded at a C, and our infant mortality rate is 5, which is still comparable to that of what is happening nationally. And when it comes to Black children and families, our preterm rates are 1.4 times higher, which is 13.4 per 1,000 live births. And our infant mortality rate is 2.1 times higher, which is 10.6 per 1,000 live births. And I feel like we need to take a moment to digest that we're still doing the work, but we're still losing children, and we're still losing mothers and opportunities to cultivate these futures. And how can we continue to have systemic and institutional change to make these things better? And so some of the ways that we've seen, or factors that we have seen, is general health care. And these are vulnerabilities: mental health and substance abuse, physical environment, socioeconomic determinants, physical health, reproductive health. There are women who have been affected by this because of weight or hypertension or diabetes or smoking. And so those are, individual factors, but we've also seen the continued systemic and institutional discrimination that has happened within our system that has caused some of these statistics as well. And so as we move forward in our work, we wanted to really understand how we as a state and we as an organization could make some of those changes to improve some of these outcomes, not only for Black children and families, but for everyone within the state, because we know this type of adversity does not discriminate. And so in terms of our policy and advocacy within Colorado, we've passed a few bills over the last couple of years that have impacted our work. And the first was House Bill 19-1122, which was the Maternal Mortality Review Committee. And that is a committee within the Department of Public Health and Environment. And they are required to review maternal deaths, identify the causes of maternal mortality, and develop recommendations to address preventable maternal deaths. And this includes legislation, policies, rules, and establishing best practices that will support the health and safety of pregnant and postpartum population in Colorado to prevent extended maternal deaths. And then within the last 2 years, we advocated with a lot of other community organizations who were more at the forefront because their work revolves around this solely. But the birth equity package was instrumental. The first bill was the Sunset Direct Entry Midwives Bill, which was continuing this program, which prepares individuals to provide prenatal, natural birth, and immediate postpartum care to pregnant women in jurisdictions, licensing, and training for midwives. And then we also had the Human Rights Bill, which was, and the data equity systems, which was really trying to establish more basic human rights standards in perinatal care for people, including those who were incarcerated, and making sure that we're centering midwifery and doula work within Colorado. And so I have spoken a lot about what we have done, but I really wanted to bring someone in that could speak to the lived experience on the ground. And so we have Nadia Grace, and her experience as a young mother led her to advocacy for cultural healing and wellness. As a current resident in Denver, she serves as a community doula, specializing in long-term postpartum care. Her further work extends into the community through partnerships with state nonprofit health plans on projects and offering hands-on services to families by addressing mental health challenges in Black postnatal spaces by utilizing her skills to address human-centered challenges strategically. She is passionate about supporting the unique needs of Black families from preconception to postnatal wellness. As she moves forward in her work, she looks to continue to build connections and collaborations that work towards empowering our unity and building a strong future and sustaining progress from our current narrative and experiences. And so I'd like to invite her to pop on so that she can talk more about her work and the trends that she's seeing and impart some of that wisdom on us.
Hello, can I be heard?
Yes.
Perfect. So thank you so much for inviting me to be here. I wanted to participate today because of the impact that the policy and advocacy work that your organization has done has really offered an opportunity for more Black families to have access to alternative healthcare modalities, to which nutrition is a major aspect of. So the work that I've done as a community doula, I've been able to participate in families' journeys from preconception to several years postpartum in in a lot of different socioeconomic backgrounds and with different belief systems and just a variety of diverse family structures with different habits and all of those things. And what I have found is, firstly, that the health and nutrition habits, processes, and thoughts that families have greatly impact the mortality rate that both babies and birth giving, can't think of the term we like to use, but mothers have when they are going through their process. And so it's all tying hand in hand because we always hear about how important our health is and how the wellness contributes to our mental health and that the things that we consume are contributing to our physical health. But there are both long term and short term effects, including the inflammation and other ancillary symptoms that we see contributing to death, specifically in our community. And so, one of the greatest things that the policy and advocacy work that you've done has allowed is for families that wouldn't typically have access to or information or the resources to pursue midwives in their communities, doulas, birth workers, and other community resources. It's given them that access. And so families are getting more information. Families are able to make more informed decisions along each stage of the process. And as you said, it is contributing to better outcomes and it's slow moving, but it's happening. And being on the ground and being able to do the work is beautiful because as we go through our process, we learn different things and we work within certain spaces. And we think that it would be great if families in our community had access to the resources and had access to more information and to informed choice regarding every step of their process. And now we're able to see that it actually does have a great impact. And even though the numbers are low, we know that if we continue to do the work that the numbers will raise and that we're moving in a forward trajectory, and that's positive, especially in the community space for us. So that's definitely something that's had a really big impact, and it's something that I see that affects us every day.
Yeah, thank you for that perspective. I'd love for you to share more with us about your work in family planning and long-term postpartum care and what that really looks like for those who are on the call who are thinking about getting into infant mortality work and some of the tools that might be beneficial for them to implement or to discuss within their organizations or within their individual lives.
Absolutely. So the different stages that I've worked with families at, for instance, through before they even get pregnant, I've worked with families as a doula capacity in various forms, from working with families that have lost children and are looking at ways that they are going to move forward in their family planning process. So there's been a variety of different health concerns that women have presented with as to why they may have lost children, or family histories and things of that nature that contributed to that factor. And one of the first things that we focus on is food um, at that point. So that's one aspect that I've worked with families preconception, is when they are at the very beginning of the process, either having experienced a loss where I've come in and worked with them as a loss doula, or they've experienced their loss and moving forward, they're wanting to conceive again. And we've gone through that process. So the next phase, of course, is when families get pregnant, which is typically when they are actively pursuing a doula because they know that they want one for delivery, or they've heard about them and they're reaching out for more information. And as a doula, our role is very dynamic and there's a lot of components to it. And it's also extremely simple because we're there to support the family in whatever they require in order to have the birth that they want. So that ranges from having home births, which I've enjoyed participating in, to birth center births, to hospital births. And I've experienced the full range of everything that goes well and presents challenges in that experience. One of the best things that I think organizations that I've worked with have been able to offer families is access to resources, whether it be mental health resources, nutritional resources, resources that have given them a better opportunity at choosing their providers, just access to people that have the information and are able to give it to them. The informed choice piece is one of the major considerations to having better outcomes. That includes breastfeeding and all of the benefits that come once families have delivered, contributing to lowering those infant and maternal mortality rates, what they should and shouldn't be consuming, which goes far beyond what they eat. One of the biggest game changers in families has been knowing what support to ask for and how to accept it. So it seems like it's all focused on improving the outcomes based on what the providers in the birth spaces are doing. And I've learned that it's not just that. It is being able to connect to people who have up-to-date information, up-to-date resources, and who can help families direct the level of support they need and how to get it. So for every organization, I feel like that has been the game changer. If you can connect a family to someone who can give them what they need or an alternative, it completely changes the experience that they have. And that's what makes the work so fulfilling for me.
I think that's phenomenal. Thank you for sharing that. I think the biggest aspect that we can all walk away with is that connection piece. Like, how are we connecting these families to resources, to knowledge, to wisdom, and to other individuals that can service them in the crucial time of their development? In our last few minutes for this portion, I'd like to ask one more question. You talk about how this work is fulfilling, and we know how the outcomes can be more beneficial when you have doulas, when you have midwives present. And so within our network, how can we promote this profession and support those individuals who are doing this work? Because we know that the doula to birthing people's ratio is very big. There's a very big gap. So how can we promote this profession in your work moving forward?
It's such a huge question because there's so many different answers. And I think that ultimately it comes down to being willing to do the work. So historically, we have a history of always getting to the point where we recognize there's an issue and we demand at some point that the issue is resolved. And what I believe is going to be most effective in actually achieving that outcome is that if you feel strongly about an aspect of what we've recognized, acknowledged is an issue, then being willing to commit to doing something about it. More than writing a letter, more than just some of those passive actions. If you know a family that doesn't have access to a doula, there's no organization in your area that offers doula to be paid for through Medicaid, like some of the programs here in Colorado, what can you do? Can you provide a meal? Can you go and visit with mom and see how she's doing? Sometimes it's holding the baby for 15 minutes so she can get some body autonomy back. Sometimes it's not having to provide a meal for dad and mom and herself. Can you take her some oatmeal? Can you do something to facilitate her process? Because that is doulaying as well. When we sit down and think about the choices that we make in regard to what we value, I feel like the most important choices are the choices we make in alignment with what we value. And so if you value allowing yourself an opportunity to contribute to reducing the maternal health rates and you're not having any more children, and you don't know anyone who you can encourage to become a midwife, or there are no resources in your area that help low-income families pay for it, be willing to do something, connect someone with someone else that can provide support. And I think that staying abreast of the information, and sometimes if it is writing a letter because no one has put forth some of the legislation that we have here, then start there and be willing to follow it through, because that's the change that's going to move the needle, is the work that each of us are willing to do in order to forward the causes that we have.
Thank you for that beautiful answer. I think the biggest takeaway is that we need to continue to do the work if we're passionate about it on a micro and a macro level. Who are the individuals that you know in your community that you can impact individually and personally, but also organizationally? And I think that is phenomenal. So I want to thank you for your time and your expertise for this portion. And thank you for the work that you continue to do in the community, because it is crucial. And very instrumental in continuing to have healthy outcomes for Black children and families and people within our state and across the nation. So thank you.
Thank you, Jalen. You as well.
So we just got done talking about infant and maternal mortality and really looking at the health outcomes for Black children and families from the start. And so now I would like to introduce our program development director, Karan, who has had over 20 years of lived experience for what many call a plant-focused nutritionist, an educator, a sower, and herbalist, to talk more about how we can look at food outcomes beyond birth in early childhood.
Thank you, Jalen, and good afternoon to you all. As Jalen stated, I am Karan P. I am your plant pusher. I love plants. I love nature. And that's really what fuels me to be doing what I do. I want to start out by offering all of my parents, yes, I know we're speaking about children, but we also have to know that it has to start with our foundation. So I want to speak directly to our community, our parents, educators, just everyone. And what I want to offer is self-empowerment. I want to take our health and remind us to put it back into our own hands through knowledge and curiosity. We are the first teachers, especially for our children from 0 to 7. We instill everything from, social behavior, as far as how we behave in community, from self-grooming, but also the relationship that we have with food. And unfortunately, us being enslaved properties of war, we came over here and we began to assimilate. And we have gotten ourselves in a space where we are following what America sells to us, which is a sad way of eating. And that is the standard American diet. Through the standard American diet, you will find that it is promoting processed foods. It is promoting man-made items using who knows what. And that is what it has become a main deterrent to us here on this soil. Because when you go and you look at our brothers and our sisters throughout the diaspora, you will find that they rely specifically on whole, fresh foods, whereas we have been conditioned to focus on processed items. When you leave outside of this country and you ask, what is American food? The question will be Chick-fil-A, Burger King, and the such. And so it is time for us to now begin to re-empower ourselves through knowledge and curiosity of food and of the connection to food, of making an appointment with nature and saying, you know what? I need to take 20 minutes and just go outside and walk around my block, walk around my neighborhood so that I can recognize what is nature. And then you will find what is food. We can no longer allow the powers that be to shame us for wanting to eat, collard greens and hog maws and beans and cornbread and fried chicken and okra and watermelon and all of these fresh items, because we are the first growers. Had we not been brought to this country, there would not be greens or okras or watermelons or any types of crops. So I encourage you to go back and utilize Sankofa and go back and fetch what is ours already, and no longer allow us, the foundation, to be caught in the assimilation of eating these processed, fast, convenient foods as a way of resistance for us here on this land. And as I'm speaking about fresh foods and going back to fetch, I want to now parlay into food knowledge. We now want to understand what is food and what is a food-like item. We want to step away from thinking that the only foods available to us are bananas and apples and oranges, and that there is an assortment of fruits and vegetables right here on these lands that are seasonally being grown for our consumption. And with food knowledge, would it not only just be the seasons, but it also would be which types of crops, when do they need to be harvested, how can they be prepared, where do we store them, how are they grown, and then the cost. When I'm in communities and I'm looking around and I'm looking at the whole everything, I'm understanding that, oh, we only have convenience stores in the ghetto. I'm gonna just keep it 1,000. We only have convenience stores in the ghetto that are sending out the message that those that live within the ghetto should only have access to these fast prepared foods, and quote unquote, those of us who have some education should have access to Whole Foods and the health food store and Sprouts and all of these things, when in fact that's not what it is, because that is really just privilege. So I ask those that are in the ghetto, or even those that live in these nice neighborhoods with Whole Foods, do you actually know the knowledge of the food that you're eating? Do you know the season that it comes out? So you can stop paying $7.99 for strawberries because you want to buy them in the dead of winter versus in the springtime right now when they're going to be coming out bountiful, knowing when to purchase the food, and then saying, you know what, I'm going to take $20 this spring and I'm going to buy, or maybe $50 worth of berries and freeze all of that. So then I can have them throughout the rest of the year. And now I'm cutting down on my food costs. So I'm asking and I'm calling for the original growers, the original plant pushers to slow down a moment, take some time and really say, you know what? Health is the ultimate wealth. I don't want to be walking around in these high quality name brands, driving these high quality vehicles, and then I'm dying. I don't even know what's going on with me because I've now placed my health into the hands of these other folks. I'm calling on you to get curious. I'm asking you to say, you know what? If I can go on Amazon and buy Jordans or whatever, I can go on Amazon and find out that, oh, wow, they accept food stamps, EBT, SNAP. I can now get food from Whole Foods. I now have access to what is not a reachable. Maybe I can't get across town to Whole Foods, but now I can do it through this Amazon, this new I call it a beast, but I don't want to say that. This new tool, okay? This new tool that can help me get access to these foods that I think aren't for me. Because when I look at my community, all I see is oranges, apples, and bananas. No, plantain, mango, fufu, cassava, okra, all of these are your birthright. They are your birthright. And so I want you to remember who you are and that you are the first teacher. You are the first celebrity. You are the first role model. So what you place into your mouth is what the child is going to place into their mouth. Don't make this some type of lesson just at school. Allow it to be the foundation that is here at your home. And then your child will go out and they will now have a new tool on their health. It won't be some type of fad or some type of trend. They'll already know how to heal thyself. They will already be tapped into a massive wealth because you decided, you know what? I'm going to fight for my health. I'm going to say, I'm not going to put my health in these people's hands. It's in my hands. I'm going to learn the seasons of the food so I know how to go in and get it. Okay. I've taught children and teens and parents how to take $20. At that time, I'm pretty sure I'm going to have to change all that because of the way food is going. But how we can take $20 and make a wholesome meal, y'all. Let's go back to eating beans and rice every day. Let's have spaghetti for 3-4 days. We ain't got to get fancy. So I don't want to get off track. I want to bring it back in. I don't want to feel like I'm preaching. I really want to just be teaching today. But I want to say the last portion here is we've got to cut out this snack culture. Okay. This snack culture is, I don't know what it is. I don't know what a snack is. Okay. What we want to do is bring back food. When your child come to you and say, Mama, I'm hungry, you're not about to give them these gummy things that look like a fruit. You're going to get up and you're going to teach your child, here, baby, I'm going to cut up an orange. I'm going to make you a peanut butter and jelly. I'm going to give you some celery. Get you some substance. The body needs the ultimate fuel, which is nutrients, nutrients, minerals, and vitamins. Okay. Those are the fuel that these temples right here need to run at their optimum best. Okay. So when you provide that to the child, then you give that to yourself. Here, we're going to go in here and make some food. I'm going to get the best food. We're going to have that. And that is now a snack, a meal, whatever you want to call it, instead of handing these darn blasted little chew gummy things. That ain't nothing but air, y'all. We feeding kids air, and then you wonder why they jumping around. I can't sit down. I don't know what to do. Because the body, the nervous system has nothing to do. When you supply the nervous system with cardboard and sugar, refined sugar, it's just in the body. Kid just, I can't sit down. I don't know how to do nothing. I gotta, But when you turn around and it's time to eat and you're giving them some sausage, some eggs, some bananas, some oranges, some grapes, some dragon fruit, they having a smoothie, a bagel, all of these wonderful things, and then they leave, they walking, they talking, they able to function. Why? Because the body is at work. Oh, we got vitamin C. We got to send it over here to the eyes. Oh, we got vitamin D. We got to do this. Oh, we got this. We got to make hair. We got to grow nails. We got to do all this. Cut out this cereal, y'all. Y'all know that's not what you had. I don't know about y'all. I'm over 40. I grew up eating oatmeal, bananas, orange juice, my mom's bread, food. My mother would say that all the time. Where is the food? Thank you very much. So I want to go ahead and say, cut out the snacks. All right. Get back, go back and fetch it. And now I want to parlay into one of the favorite snacks ever. Oh, sorry about that. Into one of the best snacks ever. Everybody loves Snickers. Everybody loves chocolate. Everybody loves some type of peanut or what have you. This is a exactly. This is a whole snack. Okay, since y'all like that word, I'm gonna use it. A whole snack. And the reason why I'm saying that is that its focus is the date. Okay, dates are our food, y'all. Just so if you know, A date is a whole, complete food, meaning it provides you with protein, nutrients, minerals, vitamins, and most importantly, a slow carb. Okay, so that means you could wake up in the morning, you in a rush, you don't have, bam, let me grab me about 3-4 dates and eat them. And the carb, the sugar from the date, it releases it at a very slow rate because it's full of the nutrients, minerals, and vitamins that you need. So that's what makes it a whole food. And our Muslim brothers and sisters, they know about eating those because they're a great food. So this will include dates. You can use whatever type of nut butters and chocolate or dark chocolate, what have you. But let's get back to making food. And thank you so much for your time.
Welcome to Cooking in the Kitchen with BCDI-Colorado as we make date Snickers. Ingredients needed are dates, peanut butter, coconut oil, and chocolate chips. To begin, you'll take your dates and create a sliver at the top to remove the pit from the inside. Once removed, set aside. Next, you'll put in a spoonful of peanut butter, as much as you desire, squish it together, and remove any excess that comes out from the top. Turn on your stove and put in a 1/2 cup of chocolate chips inside of a bowl with a tablespoon of coconut oil. Mix and combine until it is all melted down. Once chocolate is melted and slightly cooled, throw in your dates and cover on all sides. Remove from chocolate and place back on your parchment paper lined cooking sheet. Place into the refrigerator for 10 minutes for them to harden. Once hardened, remove, take off from the parchment paper, and enjoy. So I want to play it again. The recipe was so good, I guess we got to play it again. But I just want to thank Karan for your perspective. I was watching the chat go crazy. And one of the biggest takeaways that I have from the chat was somebody said, when you grow your own food, you print your own money. Okay. And as we kind of sit and think about what was just imparted on us from both Nadia and from Karan, I think the biggest thing that we can walk away with is that we are the sowers, growers, and cultivators of our health. And to close us out in terms of our BCDI Colorado portion with our experts, I just want to say that we need to continue to advocate across all borders to ensure that these basic rights are no longer considered a privilege and that we all have access to them by continuing to provide knowledge and resources for better health outcomes for Black children and families, and in turn, our whole community. And so I would like to pass it to our last expert, Mackenzie Bruner, the Policy and Outreach Specialist with CACFP.
Thank you so much, Jalen. Can everyone see my screen correctly? Yes, I'll take that as a yes. Okay. Thanks so much. As Jalen mentioned, I am Mackenzie Bruner with the National CACFP Sponsors Association. We are a partner of NBCDI, and I was super excited to have them reach out to me and ask me to share our nutrition education resources with you. So to get started, a lot of you might be wondering, what in the world is the CACFP? And I know there are some caregivers on the line, some childcare providers, and some Head Starts, so you might know what I'm talking about. But for everyone else who's unfamiliar, just a quick overview. The Child and Adult Care Food Program is a federally funded program through the United States Department of Agriculture. and it provides reimbursement to child and adult care providers for serving nutritious meals and snacks to those in their care. Serving the CACFP is an indicator of quality childcare, and the meals served are based on the dietary guidelines for Americans, and really making sure that children are getting the most nutritious meals possible by incorporating 4 key food components, which are grains, vegetables, fruits, meat and meat alternates, and fluid milk. So making sure kids get everything they need to grow happy and healthy and have that proper development. So with that being said, while we are focused on the CACFP, we have a bunch of resources available that are generally helpful for nutrition education, whether you're a parent or family member or an educator. If you just want the kids around you to help them learn more about nutrition, we have plenty of resources available to help you educate those children on nutrition. So I'm just going to give you a brief overview of what we have available, and all of these resources can be found on cacfp.org. Really simple, you can find everything there. But one thing I really wanted to highlight is we have a bunch of virtual events just like this one going on constantly. Pretty much every other week we have a virtual event that's some type of nutrition education, and a lot of those webinars are free. In fact, this afternoon we have a webinar on family style dining, conversations around the table. So you don't just have to be an actual family to have family style meals. You can be in a childcare setting or a school setting and have those conversations while sharing food together, having productive conversations about nutrition or different important topics around the table. So that's coming up today. We also have other webinars specific to the CACFP. So if you are a child care provider, you can join those as well and learn a bunch of different tips on how to successfully operate the program. We also have a fun webinar coming up in a couple months about what's a nutrition-packed sandwich. You can serve a sandwich and it can be nutritious. As Karan mentioned, it doesn't have to be that difficult. You can serve a highly nutritious sandwich, and we have a whole webinar on that if you want to learn that as well. We also have most of our webinars are recorded and they're available on demand in our Learning Center. And if you really just want to get a lot of knowledge at once, a lot of nutrition education, we have some learning paths available if you see on the right-hand side about the power of the food program. And if we have a specific learning path for Head Starts as well, and just different information on anything you want to know about the Child and Adult Care Food Program or nutrition education in general. We also have an entire site dedicated to recipes and menus. So as a caregiver, you might not have a ton of time to come up with new inventive recipes and plan out your meals for the week. So this is a really good place to just go and find highly nutritious recipes. We try to make them not complicated, and without a ton of ingredients. We want to make sure that these are cost effective as well. So you can find plenty of recipes on here, whether it's you want to make sure there's a fruit included in your child's meal. You can search by, is there a fruit in this? So we have a whole site with recipes, and we also have cycle menus as well. So again, if you're super busy and you can't plan out the week on your own, you just don't have the time, you can pull one of these cycle menus and quickly have those ideas in mind of what you need to get at the grocery store. All right, and also for those of you who do operate the CACFP, we have meal pattern cards on our site. If you're a child care provider or a parent who has a child in a child care program, you might want to learn more about this program and talk to your child care provider about it. This is a good place to get started. What do those meal patterns look like? We also have an entire video series dedicated that's called a Meal Pattern Minute. So our nutrition education specialist that we have on staff creates videos weekly. It's a 1-minute short video that will tell you, dive deeper into specific requirements of the CACFP or common questions that come out of it. And again, we have so many different types of resources for nutrition education in general. It includes activity pages that you can use with the children that you're caring for that helps them have fun while learning about nutrition and what foods give them what vitamins. The vitamin ABCs, we have activity sheets for that, and different ways that you can get kids actively involved in learning about nutrition. We also, as I mentioned, have those cycle menus and recipes. We have multiple different tip sheets on different aspects of nutrition education. So if you have an infant or you care for infants, we have a suite of resources on the different stages of infant development and what type of nutrients, how much do they need to eat to get the proper nutrients to develop. We also have just different ideas on healthier cooking methods you could use in your everyday life. We also have an entire calendar that has those activity sheets and nutrition education ideas and recipe ideas as well that you can look into also. And a good way to keep up with the resources that we're constantly turning out is our weekly e-news. We always feature new recipes we're putting out. We just had also fun activities that you can do for Leap Day. So if there's any holidays or celebrations coming up, we like to put out activities and education that you can use on those days as well. We highlight the CACFP community and just share any upcoming webinars as well. We also have a credible tools and resources e-news, which is we curate resources from all of our partners, including NBCDI, that we think would be helpful to our community. So we always include a recipe like this Oscar's Bodacious Broccoli Bites. That's from our partners at Sesame Street. We also share resources like how do you get kids to eat vegetables? How do you get them eating those as soon as possible and actually enjoying it? Well, where they'll eat them often. And we also share resources that aren't nutrition related. So how to share reading with those in your care. So how do you get started with that? Why is it important to start reading with children young? And sometimes we actually have, as you can see on the right, we had a promotion from Gerber where they provided a discount on infant products. So those are things that might show up in this e-news. And just in general, if you're interested in learning more about the CACFP or finding nutrition education resources, you can contact us at nca@cacfp.org. And you can also find us on social media as well. So with that, thank you all for having me today, and I will pass it back over to Karan.
Thank you. Wow, this was such an excellent discussion. Thank you again to our panelists. Please complete the closing poll. If you want to know more, or if you want to know how you can support NBCDI's work and prioritize Black children's health and nutrition, check out our calls to action on health and nutrition. We will post these on social media after the webinar. Feel free to share with your networks. Our next virtual learning series is May 30th. Please follow our social media or sign up for our newsletter for registration information. Check out our website. I think the link will be in the chat, www.nbcdi.org. And if you look at the virtual event resources page in particular, you will see a list of resources and links shown during the webinar. Thank you again, everyone, and have a great day. Take care.